Now, over the last few days, you've heard a lot about AI, you've heard a lot about genomics. What I want to talk to you about is something I consider to be extremely important. And my intention is that by the end of this session, each one of you will come away with at least one message that will allow you to improve your personal health and your personal life. Now, I'm going to start with a declaration, being open and honest. I am now 60 years old. Last year, I officially became a senior. My kids remind me I'm old as well, but I reflect on the fact that I've been a consultant since 1998, and I actually became a doctor back in 1988. So you will forgive me if I prefer to use the word experienced rather than old. Now, when one gets to a milestone age, one tends to start reflecting. And you start reflecting personally, but also professionally. And in my professional reflections, I came across this quote, forgive me while I get to the clicker, from Thomas Edison. Now, if you read that, you can see that the doctor of the future, he believed, will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. Now, in fairness to Mr. Edison, who went on to far greater things, this quote is 140 years old. But if we just look at that and break down, in terms of cause and prevention of disease, we know so much more about the cause of disease than we did when I first went into medicine and first went to medical school back in 1982. So our knowledge has increased enormously. There's a great focus today and throughout this conference on prevention of disease, which I will touch on later. When it comes to diet, it has been said by men wiser than me that having a medical degree after your name is proof that you know absolutely nothing about nutrition. And I think for a long time that's been very true. It's changing. It's getting more and more involved in medical school syllabi as we go on, but there's still a huge gap. Now, Edison's prediction about giving no medicine, well, I think he got that one slightly wrong. If you consider my average diabetic patient, I'm now seeing patients who are on 1 or 2 tablets for cholesterol, 1 or 2 for hypertension. They may have something from the cardiologist, they may have aspirin, something from the kidney doctors, and then you get to me. And I'm giving them tablets, or I'm giving them insulin injections, or some of the very trendy and oh so popular weight loss injections at the moment, such as Ozempic, Mounjaro, Wegovy. So that aspect really hasn't gone quite right. Now, I'm going to put up my next slide in advance so that you can see this definition, but just to tell you how I arrived being interested in this, when you do get to a milestone, you do reflect on your personal well-being as well. And when I turned 59, and more specifically my wife, began to take more of an interest in my health. Sorry, can you hear me okay above the noise? I'll hold it closer. Does that help? Excellent. Okay, I could see a few anxious faces in the audience. Now, when I got to 59, my wife in particular pointed out that I was overweight, stressed, not exercising, not sleeping properly, and I also have a family history of type 2 diabetes, being of Arabic genetic stock, and a family history of premature cardiovascular disease. So we decided, or rather I decided, to listen to my wife as we took matters in hand. And we moved to a much more plant-based diet, aimed specifically at improving the gut microbiome, being influenced by the Zoe project in the UK. Began to exercise more, but a more age-appropriate form of exercise. I've always done yoga, but I started doing Pilates and Reformer Pilates, and more recently I've introduced something horrendous called Legree Megaformer, which you're welcome to talk to me about afterwards. But it makes the point that as we get older, our exercise needs change. Now, my wife then asked me, had I heard of this thing called lifestyle medicine? And I had to confess, I really hadn't. It really hadn't entered my consciousness. And when I think about my dietary advice and exercise advice in diabetes clinics over the year, often it's been move more, eat less, see the dietitian. And it's been that kind of simplistic. We've always known lifestyle is crucial to diabetes care, but to an extent, as physicians, we've often paid lip service to it. Wow, it is getting loud here, isn't it? So anyway, we looked into lifestyle medicine. When I saw this definition, this appealed to me. Because as you can see, it is a medical specialty that uses lifestyle intervention as the primary treatment. That it doesn't exclude the use of medicines, doesn't exclude surgical referrals, but it does mean that we use this as the primary modality of treatment. And it's used for chronic conditions, as listed here, including my own of type 2 diabetes that I deal with, but not exclusively to these. I also like the fact it wanted to have certified physicians who self-practice, because self-practice is kind of what I'd fallen into when I looked at this. And in terms of certification, I made the I'm pleased I did it decision to certify last year, although when I was sat in a 4-hour exam answering 150 MCQs, doing the first exam of this type for over 30 years, it didn't feel like the greatest idea in the world. But I got my certification in December. And what also appealed to me was, I come from a scientific background. I've been a doctor all my life. I wanted this to be evidence-based, but I've worked in a specialty that had always been holistic. And the programs they were talking about were intensive intervention. But what were the areas that we were talking about? Well, there are 6 core areas, which I'm going to have to shout about to get over the noise. I've been told I'm a natural PA system anyway, so if you can't hear me, I'm doing something very wrong. But these are the 6 core areas that you can see on screen above you. The diet that's proposed is essentially whole grain and predominantly plant-based diet. And that was very much what I was beginning to follow. I'm not exclusively vegetarian, but I'm trying to be vegetarian by week. Physical activity, we know the benefits of. Good sleep, which I think most of us as doctors have really never studied and known anything about. Stress management, well, we know plenty of stress, but managing it is more of a challenge. There are obvious health benefits to avoiding or restricting the use of substances such as alcohol and tobacco. And the one at the end is an interesting one that I will come back to, I promise you. So, why is this important and why is there a need? Well, if we first of all look at type 2 diabetes, in the UAE at the moment, 16.5% of all adults have type 2 diabetes. And that's actually an improvement from where we were a few years ago when it was around 20%. Now, those are the cases we know about, because it's accepted that probably another 2/3 of all diabetes cases are not diagnosed at present. So there is an overwhelming problem with the prevalence of diabetes and all the complications that come with it. Now, one of the major risk factors for diabetes is, of course, obesity. And you'll be pleased to know that here in Dubai, you're in the slimmest of the Emirates in the UAE. The prevalence of obesity here is only 22%. It's 1 in 5 adults in Dubai who are obese. But if you go out to provinces like Ajman and Fujairah, you find that rises to nearly 40%. So overall, it's 27%. Now, not only is there a health cost to obesity through more diabetes, cardiovascular disease, some related cancers, some related sleep problems such as sleep apnea, but there is a financial cost to all health economies. And just to quote you the data from the World Obesity Federation, it's predicted that obesity alone, by 2035, will account for 4.8% of the gross domestic product of this country. Now that sounds abstract, but if I tell you that's $32 billion a year, that's quite a sobering thought. What's even more sobering is that less than 2 billion of that is predicted to be spent on healthcare direct costs. The rest comes from the cost of people being away from work, being at work but unable to work effectively and properly, and therefore affecting the economy, and finally and most sadly through premature death. So just hold that figure of 32 billion, hold that figure of 16.5% prevalence of type 2 diabetes here, and you have reasons why we should be looking for every option to prevent this disease and treat it and keep people away from it. Now, what I'd like to go on to is to talk to you a little bit about my area of type 2 diabetes, the kind of evidence that exists for lifestyle interventions in these areas. So I'm going to begin with prevention. Now, I'll take you back to 2002 to the Diabetes Prevention Programme, where in this particular study, there were about 3,000 patients who were divided up into 3 groups, 3 equal-sized matched groups. The first was just given standard lifestyle advice of the sort of move more, eat less, lose weight, look after yourself. The second were, in addition, given a drug, metformin, which many of you may have heard of, which is used in the treatment of diabetes, but in this case was being used in a group of patients who all had pre-diabetes. So the idea of this was to stop these patients who didn't have normal sugars, had not yet reached diabetes, from trying to move up to diabetes. And the third group was given an intensive lifestyle change program for 24 weeks. And that aimed at reducing their body weight by 7%, using a low-calorie, low-fat diet, but also of encouraging them to do at least 150 minutes of brisk activity per week. Now, the definition of brisk activity, the best definition I've come across is the talk test, which basically says, if you're doing exercise and you were able to sing, that's not exercise. It doesn't count. So if you're going for a gentle walk in a mall and you could break into song at any moment, that's definitely not exercise. So brisk activity, you want to be building up your heart rate, building up something of a sweat. So 3 arms, 3 groups of pre-diabetics. How did they fare? Well, metformin, the tablet, helped compared to the simple lifestyle group. And it reduced the incidence of diabetes by a very impressive 38%. But what's striking is that lifestyle intervention program alone with no medication was actually more effective. It reduced it by 51%. Now, there are caveats to this. This is talking about behaviour change. Behaviour change is difficult to maintain. We all know that. New Year resolutions, how many of them do we all keep? But we know that 50% of the active intervention group achieved that 7% weight loss at 24 weeks, but only 38% was still there at the last visit towards the end of the 2.8 years of the trial. In terms of exercise, which you have to remember was self-reported, so this wasn't anything that was being monitored, it relied on the honesty of those taking part. 74% met the exercise goal at 24 weeks, but by the last visit, there's a drop to 58%. So it shows that lifestyle intervention can work at preventing diabetes, but one of the challenges we face is maintaining those behaviours and maintaining that change, because as time goes on, people find it harder. Okay, so I'm going to put this slide back up and I'm going to talk to you a little now about remission from diabetes. In other words, those who've got diabetes, but we want to try to cure them. Now, the evidence for this goes back to 2010 from Roy Taylor's group in Newcastle. Now, what he proved back then was with 9 diabetes patients subjected to a 600 kilocalorie a day. And just think about that, 600 calories a day. That's not sustainable. But in 1 week, you could actually bring their sugar levels back down to normal. And their liver insulin sensitivity improved as well. And that was maintained at 8 weeks. Now, that original group was patients who had short duration of diabetes of less than 4 years. But a few years on, they demonstrated the same was possible in patients with longer duration of diabetes. But you might ask, that's okay under strict condition with strict calories, but what happens in the real world? So in 2018, a study called Direct was published in the north of England, which looked at 300 patients being looked after by their family physicians and given intensive lifestyle programs. And what was found that at the end of year 1, 46% of those patients were off all their diabetes meds and no longer had biochemical evidence of diabetes. So they were effectively in remission. Now, by the end of 2 years, that had dropped to 33%. By the end of 5 years, it was down to only 14%, and it was maintained in those who managed to keep weight off. So rather like the DPP, this proves that this is doable, these things are reversible, but patients need ongoing support and structures of ongoing support if we're going to maintain those benefits for patients. So when we think about remission and prevention, we've demonstrated that lifestyle interventions can help. The big ones people think about are nutrition and about exercise, and exercise alone can actually reverse diabetes, but it's nowhere near as effective as diet, and it's worth using the two together. Remember, when you're thinking about weight loss as a whole, people will say, but I'm walking, I'm exercising. Exercise accounts for about 15 to 20% of all weight loss. The rest really comes through what we eat. It's a little more complex than that, but time permits me from exploring that any further. But there are undoubted additional benefits to exercise which we shouldn't ignore, not least improving our blood pressure, reducing cardiovascular risk, but also our general well-being and happiness with life. And the effect on mood is particularly important in type 2 diabetes, where depression is more common in people with type 2 diabetes, and type 2 diabetes is more common in those who are depressed. So exercise as a modality is really important and has been shown to be as effective as cognitive behavioural therapy when you come to the treatment of depression. So there are really good reasons to be thinking about these factors. Now, when it comes to treatment of diabetes using those with established diabetes, I'm not going to get into the difficult world of nutrition because that's full of different ideas on the right kind of diet. I don't even use the word diet anymore. I use dietary restriction. I use the best phrase I think we can use is just talk about eating patterns, because diet sounds like too punitive a word. But there's evidence that exercise alone over 2 years can reduce your HbA1c, your measure of sugars, by 1.4%. What I want to focus on for the rest of the time that I have is two of these areas that we don't often talk about: good sleep and positive social connections and outlook. So sleep is crucial to everything we do. We should all be aiming for 7 to 9 hours of sleep a night. How many of us get that? Show of hands. You do. You go to the top of the class. You did better than me last night as well. But the problem is bad disrupted sleep. Sorry, I think, that's better. Affects your hormones and affects your physiology. It increases your sugars. It increases your blood pressure. It increases your main stress hormone, cortisol. But what it also does is increase your hunger hormone, ghrelin, and it reduces your appetite suppressing hormone, leptin. So to all those people who are on things like Mounjaro and Wegovy, where we're trying to suppress appetite, if they're not sleeping well, their behavior is counteracting the role of the drug. So I think it's incumbent upon us professionals to actually look and explore these things. And of course, poor sleep will increase your risk of type 2 diabetes, it will increase your risk of heart disease, and so on. So sleep is important. The other thing that we don't really think about, and always makes me feel like I should rush out and hug a tree, is when people start talking about things like positive social connections and positive psychology. But there is a wealth of evidence for the importance of these, and some of it's very surprising. Framingham is a city in Massachusetts in the US where a lot of work was done looking at things like blood pressure and heart risk. But there's also been a 20-year project looking at social networks there to see what impact we as human beings connected through our social networks have on each other. And the very surprising finding is that our emotions are contagious. So you might think, well, okay, if I behave badly, it will affect my friends and family. But actually, there are not 1, not 2, but 3 degrees of separation here. So my behaviors will be affected not just by my friends, but the friends of my friends of my friends. So that if they are unhappy, that spreads down the line. And strangely enough, the same pattern is seen with obesity. So the behaviours that lead to obesity equally are contagious. And perhaps that's not... I think that's better, we're back. That's not surprising given the kind of normalisation of some behaviours that we see that are not healthy for us. Now, how many of you have heard of the blue zones? Any of you? One of you. I won't ask you for a detailed breakdown. The blue zones were investigated by an American called Dan Butner, and they're the communities around the world that are found to have the longest living people in the world, more centenarians than anywhere else. And they're based in places as different as Japan, Costa Rica, Greece, Loma Linda in California, and in Sardinia. The things that characterize them are, firstly, they all have great activity in day-to-day life. Secondly, their diets are predominantly plant-based and are local. But the one that's most important appears to be social connection, sense of purpose, a sense of being together. And I think it's very important to note that the UAE has recently decided that 2025 is the year of community. I think that's terribly important to remember, and it's a really good positive step in the right direction. Now, if we look at so the blue zones teach us something about this. But the one that really impresses me, and why I will come back to my wife, is that the Harvard longitudinal study is the longest longitudinal study in the world. It began in 1938, and it's followed through a group of Harvard graduates and their children, their children's children, all the way through. And the single biggest determinant of happiness in that group is not how well you diet, well you exercise. It's your social connections, your relationships with people, and above all, your relationship with your spouse. So I would put to you that there is more truth behind happy wife, happy life than you might have imagined. So, if I may summarize, I think I've demonstrated to you why I believe lifestyle medicine is important in management. I've shown that there is plenty of evidence going back over the years to show that it can prevent, it can reverse, and it can treat diabetes. I think this is a growing area. I mean, I note with interest that in Abu Dhabi we have our first licensed healthy living and longevity centre supported by the Department of Health. But I believe this has to become mainstream. As I sort of look back on my time in diabetes, I believe this has to be part of standard diabetes care with certified motivated physicians working alongside like-minded dietitians or nutritionists, educators, but also clinical psychologists, sports therapists, mentors, coaches, because we need to set up a structure that will support our patients in maintaining these lifestyle changes that can be so beneficial to them. So, I said at the beginning, I hoped that you would all get something from this talk and you'd all have maybe one of these areas you want to go away and think about. Because after all, we all want to live a long time, but we also want to live well. So thank you very much for your attention. And I think I've got time to take on a few questions if need be, if there are any.
Okay.
Do it. Oh, okay.
Great talk, Doctor. I have a very obvious question. I come from part of the world where it's very cold. We've got lots of green parks, green spaces, but I don't see much green spaces here in the middle in Abu Dhabi, Dubai, and it's very hot here. So, what advice do you give to people from April to October? How will they connect with outdoor living?
Well, you're right. Outdoor living in itself is more of a challenge, but you can still go and walk at night. It's humid, it's sticky, but you're still outside. And in terms of, I get various excuses through the year. At the moment, it's too cold for people to exercise. In the summer, it's too hot. In the summer, I point out, you have the best air-conditioned gyms in the world here. It's fantastic. The facilities are amazing. But you're right. In terms of green space, you're right. It's something that's really struck me because, obviously I'm from the UK and think of London and the huge green public areas. It's something for urban planners to think about. We do see, and I live in an area in Abu Dhabi where there's huge growth of buildings, but there aren't the green spaces to go with it. There are parks around Abu Dhabi which are good and they're very well used when they're there. But I think this is something that needs to go a little bit above my pay grade to urban planning. But remember, that the problem is, I think, that land is worth a lot, and it's worth a lot if you put an apartment building or an office on it rather than a park. So my wife and I joke that empty, dusty area next to us in front of the Aldar HQ will one day be a green gazelle park sometime that we can all use. But you're quite right, it's a real problem. Of course.
Thank you so much for an amazing talk, very impressive. I have a personal question for you.
Okay.
So, you look a decade younger than what your age is actually. So
I know a good ophthalmologist if you need one, don't worry.
Everybody would agree to that. And my question is, can we know your lifestyle routine? Out of the pointers that you mentioned, how many of them do you follow personally?
Well, that's a very, very good point because it's about professional authenticity. So I do try to exercise, say, 4 or 5 hours a week of moderate to high intensity exercise. I'm vegetarian by week under the careful eye of my wife, who I listen to, and that's very important. And in terms of sleep, I have got much better at not watching late night football TV. I didn't even watch the Arsenal game last night. I went to bed at a decent time. So actually, I try to follow those. And I think one of the most important is the social connections and having a positive outlook. It's very easy when you're in a profession called, like medicine, to be under stress, not to be optimistic, not to be positive. But I think the difference is, if you decide that you're going to try to be more positive, that helps. And the other thing is, it helps your professional life. My consultations have changed immeasurably in the last year, in that the type of conversations I'm having with patients, once you delve into their sleep patterns, their exercise patterns in detail, you have a different relationship with them. And what you begin to do is connect as human beings. And I think that's one of the biggest changes I've noticed over the last year. I won't share with you my breakfast details or anything else. You don't need the lowdown. Let's just say that on top of the yogurt, the kefir, the nuts, the seeds, there is a little bit of honey, because none of us is perfect. Okay, so thank you very much for your time. Really appreciate your attendance.